Before the breast examination, it is crucial for you to, like every examination, to introduce who you are and your role. It's also important to address the patient by her full name. That is also important to verify her identity. Following that, you should explain the purpose of the examination. Why are you doing this? And what does the examination involve? And because this is an intimate examination, it is crucial for you to emphasize the privacy and confidentiality of this examination. Remember to mention that there will be a female chaperone present throughout this examination. And once that is done, get a permission before proceeding. Remember to wash your hands. Like every examination, we begin with inspection. We first start to request the patient to undress to her waist, to stand or sit upright, and remove her bra. What you want to do is you want to inspect both breasts, looking for the symmetry, whether there's any swelling that's obvious and can be seen, any obvious skin changes. Look at the nipples, look for abnormalities there, and also not forgetting the areola. You should be inspecting the breast in these 4 following positions. So for the palpation, what you need to do is to have the patient lie either supine or at a 45-degree angle with her head on a pillow and her arms either placed above or under her head. And you are to palpate the breast one at a time. And this is how you are to palpate the breast. So you want to palpate the breast tissue with the palmar surface of your 3 middle fingers using the palp. What we want to do is we want to palpate in a soft rolling motion, all right, preferably clockwise from the outside towards the middle. And while you're doing that, what we're trying to do is we're trying to look for any lumps or any mass or any thickening within the breast tissue. So soft rolling motion using the palp of your fingers. And so when we approach the areola, you must also palpate the areola as well, feeling for the breast tissue under that. And then you want to palpate the nipple. What is important is we need to express the nipple for any discharge within. And how you do that is you squeeze gently. And if there's any discharge, you want to note for the color or the consistency of the discharge. Continue the palpation on the other breast the same way you did the palpation of the left breast. Once that is done, it is important that you examine the axillary lymph nodes of both sides. Every breast examination should be followed by an axillary lymph node examination. Now your examination is done. At this point, you should thank your patient, offer your assistance to help her dress. You may present your findings to her and wash your hands once the examination is complete.